Franzen moves to amend Senate File number 4410, the unofficial engrossment as amended. The amendment is coded A12.
The member from Douglas, Representative Franzen.
Thank you, members, and to the public that is watching. So the amendment before you is going to study adverse reactions to the COVID vaccines, as well as require MDH to monitor trends, health outcomes, and quality of life for patients who experience adverse reactions to COVID vaccines. It would also create a $5 million fund to compensate patients who faced serious adverse reactions to the COVID-19 vaccine. President Biden recently quoted, "Imagine had the tobacco industry been immune to being sued." Well, that's the sweet deal that pharma has with vaccines. We can go back and do the history of the 1986 Vaccine Injury Act. Through the 70s and 80s, there was a number of lawsuits brought forward due to the DPT lawsuits against vaccine manufacturers. And those lawsuits were increasing dramatically, and the manufacturers were saying, we're just not going to do this anymore because it's way too costly. So fast forward in 1986, the Vaccine Injury Compensation Act was passed, and pharma was given a pretty sweet deal. Those on the vaccine schedule would be held harmless from lawsuits, and families could petition the government for financial assistance, and if they qualified, there would be a payout. It's very difficult to get a payout because most people, when they say they have an adverse reaction or parents say that their child had an adverse reaction, they are not believed. In 2010, the Countermeasures Injury Compensation Program, or CICP, was created. It was created to provide compensation from injuries or death as a result of government-mandated or recommended vaccines, drugs, or medical devices as declared by the Secretary of Health and Human Services to address a public health emergency. Today, we are going to focus on the COVID-19 vaccine. We are not going to focus on the vaccines on the childhood schedule. Today, this discussion is simply COVID-19 vaccines. So remember the days when cigarettes, although not FDA approved, it is regulated by the FDA, but cigarettes were considered safe. Doctors said cigarettes are safe. People smoked. You'd have smoking rooms in hospitals. And then one day, they weren't safe anymore, were they? There were lawsuits, and Minnesota was privy to a $6.5 billion payout. Or imagine this, what if opioids were a liability-free product, right? Remember the Sackler family at Purdue? Sacklers lied, people died. Imagine if Congress had given immunity to the manufacturers of opioids. And what if that same product was mandated? Could you imagine? You know what other pharma products were considered safe but ended up not being quite so safe? Because the government, through lawsuits, found out that pharma had lied. DDT, Agent Orange, talcum powder, mercury, asbestos, phthalimide, Vioxx, also opioids. The pharma industry has a history of fraud, bribery, lawsuits, scandals. This is not a conspiracy, it's the truth. They continue, the big pharma business continues to do business. So this amendment I am bringing forward is because adverse reactions are real. Vaccine injuries are real. Recently, there was a press conference with those individuals, some individuals who had adverse reactions to the COVID-19 vaccine. Some of those same individuals met with Governor Walz's staff to discuss their reactions to the COVID-19 vaccine. These individuals that showed up at the press conference did what they thought they were doing for the better of society, to keep themselves safe and for others safe. Now they are not believed. This one individual, Susanna Newell, described at the press conference how her health changed dramatically within 30 hours of taking the COVID-19 vaccine. She was a once active triathlete who had no underlying health conditions. Her story was raw, it was real, and it was heartbreaking. She is one of many individuals in our communities, in the state, around the country, and around the world who have suffered as Pfizer profits. Their first quarter sales this year hit $26 billion. Those who suffer the adverse reactions assume all the liability. Big Pharma assumes all the risk. Judicial Watch took Pfizer to court and said, hey, we want to see the documents. Pfizer said to the courts, it's going to take 75 years and we will release them. 75 years. Well, Pfizer did not get their way, and now there are data dumps. So this one data dump is and this comes straight from the courts. It's about Pfizer. The cumulative analysis of post-authorization adverse event reports received through February 28th, 2021. And on page 6, due to the large numbers of spontaneous adverse event reports received for the product, blah, 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 Pfizer has taken multiple actions to help alleviate the large increase of adverse event reports. This includes significant technology enhancements and process and workflow solutions, as well as increasing the number of data entry and case processing colleagues. To date, Pfizer has onboarded approximately 600 additional full-time employees. More are joining each month, with an expected total of more than 1,800 additional resources by the end of June 2021. One of the big things that we are hearing about with the young kids is myocarditis. When that age group, when the 12 to 18-year-olds, when it was authorized, these reports were coming out. And those that were speaking about the concerns of myocarditis were told that they are conspiracy theorists, and Twitter would ban them from their social platform. Now it's being studied. April 20th, which wasn't that long ago, 2022, there was a study done. SARS-CoV-2 vaccination and myocarditis in a Nordic cohort study of 23 million residents. The findings in a cohort study of 23.1 million residents across 4 Nordic countries, risk of myocarditis after the first and second doses of SARS-CoV-2 mRNA vaccines was highest in young males aged 16 to 24 years after the second dose. For young males receiving 2 doses of the same vaccine, data were compatible with between 4 and 7 excess events in 28 days per 100,000 vaccines after a second dose BNT 162b2, and between 9 and 28 per 100,000 vaccinees after second dose mRNA 1273. The meaning, it says in this study, the risk of myocarditis in this large cohort study was highest in young males after the second SARS CoV-2 vaccine dose. And this risk should be balanced against the benefits of protecting against severe COVID-19 disease. So members, I plead with you and I beg you to believe these people, because vaccine injury is real and they need a voice at the table. No matter where you stand on vaccines, this is not an issue of pro-vaccine, it's not an issue of anti-vaccine. This is a discussion of a liability-free product that an individual has taken, and now they suffer from it with no recourse. So I ask you to please, please support the amendment.
Member from Hennepin, Representative Freiberg.
Thank you, Madam Speaker. I encourage members to vote against this amendment for a few reasons. First, it takes money away from a really important program, Representative Bolden's proposal to fund COVID-19 tests, masks, and respirators. We've seen COVID-19 cases steadily increasing over the last few weeks, increasing the need for tests and masks. Representative Bolden showed a lot of foresight advocating for this program. Second, the amendment is unnecessary because it duplicates a compensation program that already exists at the federal level. And you can visit the website for the Health Resources and Services Administration's Countermeasures Injury Compensation Program at hrsa.gov/CICP if you want more information. And thank you to Representative Franson for mentioning that program. Finally, and probably most important, the COVID vaccines are safe. Millions of people in the United States have received COVID-19 vaccines under the most intense safety monitoring in U.S. history. COVID-19 vaccines were evaluated through clinical trials involving tens of thousands of participants. The vaccines met the FDA's rigorous scientific standards for safety, effectiveness, and manufacturing quality. There were comparisons made to cigarettes, but there is no comparison because commercial tobacco has no medically beneficial use. Vaccines save lives. There was a question asked saying essentially, can you imagine if tobacco was mandated? That's not relevant because there is no government mandate in place for the COVID-19 vaccine. Because of the safety of the vaccine and the existence of a federal compensation program, there is no need to divert funding from a critical program, and I encourage members to vote no.
Representative Franson.
Thank you, Madam Speaker. And before I continue on, I would like to request a roll call.
Representative Franson requests a roll call. Seeing 15 hands, there will be a roll call. Representative Franson.
Members, just last week we passed a bill that had $190 million in it for COVID response. I think we can take this issue very seriously, no matter your view on the COVID-19 vaccine. Put it this way. If there are no adverse reactions and nobody is getting sick from the vaccine, nobody's dying from the vaccine, your precious $5 million will not be touched. But we are hearing, and it's not just me, there are members or not members, I shouldn't say members, there are individuals in this Capitol that have come to me and others here in this chamber about their reaction to the COVID-19 vaccine. There is a doctor from the Mayo who suffers from tendinitis. COVID-19 vaccine. As far as the mandates, Governor Walz himself played doctor and mandated that state employees, contractors, you name it, if they benefit from the state of Minnesota, they receive dollars from the state of Minnesota, they have to take the COVID-19 vaccine or be tested. Majority of people said, I'm just not going to deal with the weekly testing, I'll just get vaccinated. Some people left the state. The U of M, the regents, decided, you know what? We're going to mandate the COVID-19 vaccine as well for the students if they want to attend here. And at first, the U of M tried to ignore the religious exemption to the COVID-19 vaccine. This issue is real. Your vote today will determine if you are going to stand with Big Pharma or you are going to stand with the individuals who have taken the vaccine and did their part, but now suffer health effects. These data dumps are real. I believe there was another data dump of 80,000 pages done today from Pfizer. The studies are real. However, for some reason, phthalimide can be found unsafe. Vioxx can be found unsafe. Opioids can be found unsafe. But when it comes to the holy grail of a vaccine, the walls go up and the talking points of safe and effective come out. Members, I request a yes vote.
Seeing the member from Hennepin? No. Seeing no further discussion, the clerk will take the roll on the amendment. Members, please vote. Will the clerk please call the names of the members who've not yet voted?
Berg.
Berg, no.
Berg, no. Hamilton.
Hamilton, no.
Hamilton, no. Houseman.
Houseman, no.
Houseman, no. Moran.
Moran, no.
Moran, no. Pearson.
Pearson, aye.
Pearson, aye. Thompson.
No.
Thompson, no.
The clerk will close the roll.